The final paper in the 7 papers in the BMJ about core grade deals with moving from evidence to recommendations. You have now summarized your evidence in summary of findings tables. You've done your optimal systematic review, applied all the grade criteria, and got your summary of findings tables. And you are going to use that summary of findings table to go from evidence to recommendations. Core grade has an approach which we call the evidence to decision framework, and that evidence to decision framework for core grade focuses on the individual patient perspective. It pictures the patient with the clinician working together through shared decision making to make the right decision for the patient. And what are they going to consider? They are going to consider the benefits, harms, and burdens associated with the intervention and the comparator. They're going to consider the certainty of the evidence, and they're going to consider patient values and preferences. Oh, that's the key things they're going to consider from the patient perspective. But core grade accommodates a secondary perspective, which is a population or public health perspective. And if you bring in that secondary perspective, you're also going to be considering issues of cost, feasibility, acceptability, and equity. So you got your summary findings tables, you got your benefits, harms, and burdens, your certainty, your value and preferences, and then these secondary issues if you bring in a population and public health perspective, and you are then going to make a decision. You're going to either make a recommendation in favor of the intervention or against the intervention. And you're also going to decide on the strength of the recommendation. Core grade, simple approach. The recommendation can be either strong on the one hand or conditional, also known as a weak recommendation, on the other hand. If the benefits clearly outweigh the downsides, it's going to be a strong recommendation. If they are more closely balanced, so that some fully informed patients would choose the recommended treatment or approach, but a minority, typically because of different values and preferences, would make a different choice, and that tells you you need a weak or conditional recommendation. So there is all you need. One-stop shopping to apply grade, to apply the essentials of grade, the core grade, summarized in 7 papers, there for you, very accessible in the British Medical Journal.